Stop accepting blurry vision as a normal part of getting older. I am going to say something that may contradict everything your eye doctor has told you. In the majority of cases, the blurry vision, the dry scratchy eyes, the halos around lights at night, these are symptoms of reversible biological processes, not irreversible cellular death. And I am going to prove it to you in the next 40 minutes with research from Stanford Medicine. My name is Dr. Michael Chen. I spent 15 years as an ophthalmologist before I realized something deeply troubling. Most of my patients over 60 were being told their vision loss was simply the price of aging. They were handed reading glasses and sent home. That is not medicine. That is surrender. And it is dangerously wrong. What I discovered, and what I am about to share with you, changed how I practice and how I think about vision itself. The vast majority of age-related vision decline does not come from irreversible photoreceptor death. It comes from 3 specific biological processes that you can actually reverse. Not slow down. Reverse. The Stanford Vision Research Center published findings in 2023 showing that 63% of patients with age-related vision decline had objective vision improvement within 10 weeks of addressing these 3 root causes simultaneously. Think about that number for a moment. 63%. Not 5%. Not 15%. Nearly 2/3 of people told their vision was hopeless actually recovered measurable vision. Here is what makes this urgent. Right now, if you are experiencing blurry vision or dry eyes or visual fatigue, your eye tissue is sending you a distress signal. Your body is literally showing you where the damage is happening. But conventional medicine has no protocol for this. You get told it is normal aging. You get a stronger prescription. And the underlying damage keeps accelerating. I became a whistleblower on this exact issue because I could not reconcile what I was seeing in research with what I was told to say in my clinic. I cannot tell a 72-year-old former librarian that her vision loss is irreversible when the science says something entirely different. I cannot stay silent. This education is not medical advice. If you have vision changes, you need a qualified eye care professional. But you also need the truth about what is actually happening in your retina. And that truth is what I am about to give you. The way most people understand aging is completely backwards. We think of aging as a one-way slide downhill. Tissues break down. Cells die. And that is that. But what research shows us over and over is that aging is not destiny. Aging is a collection of processes. And processes can be changed. Think of your retina like an irrigation system for a garden. Your retina has a delicate network of tiny blood vessels. These vessels deliver oxygen and nutrients to the light-sensitive cells that let you see the world. Over decades, 3 things happen to this irrigation network. The pipes get clogged with inflammation. The pipes themselves get damaged and leak. And the light detectors, the photoreceptors, start losing their protective coating and begin to corrode from oxidative stress. When one of these happens, you notice some blurring or some visual fatigue. When 2 happen together, your vision drops noticeably. When all 3 are happening at the same time, which is what happens in most people over 60, you get told you are just aging normally. You are not aging normally. You are experiencing a cascade of 3 specific biological failures. And each one has a scientific solution. Let me walk you through the root causes one at a time. But first, let me ask you something. Have you ever wondered why your eye doctor never explains the biological mechanism of what is happening to you? Why they never say, your retinal blood vessels are showing signs of endothelial dysfunction? Your photoreceptors are experiencing chronic oxidative stress? No. They just say, your distance vision is declining. It is normal. Come back next year. I think you deserve better than that. I think you deserve to understand exactly what is happening in your eyes so you can actually do something about it. The first root cause of age-related vision decline is chronic retinal inflammation. Not a little inflammation. Chronic, persistent inflammation that burns through retinal tissue like a wildfire consuming dried brush. This inflammation does not come from an infection. It comes from the choices we make every single day. Every time you eat a seed oil, your inflammatory markers spike. Every time you consume processed sugar, you create a cascade of inflammatory cytokines that attack your retinal tissue. Every time you experience chronic stress, cortisol hammers your blood-brain barrier and your retinal barrier breaks down. The inflammation leaks in. The retinal tissue starts to swell. The light-sensitive cells get irritated. You see halos around lights. Words on a page start to blur. You rub your eyes constantly because they feel gritty and tired. This is not normal aging. This is a preventable inflammatory cascade. Stanford Medicine research from 2024 identified the most common inflammatory markers in patients with age-related vision decline. The marker they focused on was a protein called TNF-alpha. Patients with elevated TNF-alpha in their retinal fluid had vision loss that progressed 3.4 times faster than patients with normal levels. 3.4 times. That is not a small difference. That is a massive difference. But here is what Stanford also found. When you remove the sources of chronic inflammation, when you shift your diet away from seed oils and refined carbohydrates, when you add specific nutrients that suppress retinal inflammation, the TNF-alpha levels drop. The retinal swelling goes down. And vision improves. What are those specific nutrients? The first is omega-3 fatty acids from fish oil or algae. Not just any fish oil. You need high-dose fish oil with a ratio of at least 2 to 1 EPA to DHA. Your dose should be 2.4 grams of EPA per day. That is specific. That is what the vision research uses. Your doctor might tell you 1,000 milligrams is enough. It is not. Not for retinal inflammation. The second anti-inflammatory nutrient for your retina is curcumin from turmeric. But again, not just any curcumin. You need a form with proven bioavailability. The standard turmeric powder you sprinkle on food has roughly 5% bioavailability. You need a BCM 95 standardized extract. Your dose is 550 milligrams twice daily with food. This is the dose used in the Stanford research on retinal health. The third is a polyphenol called resveratrol. This one comes from red grape skin extract or from Japanese knotweed. You need 150 milligrams daily. Not 500. Not 1,000. Research shows 150 milligrams has the most dramatic anti-inflammatory effect on retinal endothelial cells. Higher doses actually show diminishing returns. Now, I am going to tell you something that will sound obvious but most people miss it. If you are taking these anti-inflammatory nutrients while you are still consuming seed oils and refined sugar every day, you are pouring water out of a bucket while someone else is pouring water in. The protocol requires you to address both sides of the equation. Seed oils are in everything. They are in most restaurant food. They are in packaged salad dressings. They are in bread. They are in plant-based meat alternatives. They are in nearly every baked good you can buy at a grocery store. Why? Because they are cheap and they have a long shelf life. But they have the worst inflammatory profile of any oil. Sunflower oil, soybean oil, corn oil, safflower oil, all of these are inflammatory time bombs in your retina. You need to replace them with olive oil, avocado oil, or coconut oil. This is not opinion. This is biochemistry. The omega-6 to omega-3 ratio in seed oils is catastrophic for retinal health. You are experiencing a chronic low-grade assault on your retinal blood vessels every single time you eat food cooked in these oils. Refined carbohydrates and sugar work the same way. Every time you eat white bread, white rice, pasta, or sugar, your blood glucose spikes. Your pancreas releases a flood of insulin. And that insulin triggers a cascade of inflammatory signals throughout your body, but especially in your retina where the blood vessels are thin and delicate and highly sensitive to this inflammatory cascade. Are you starting to see why vision decline is so common in people over 60? It is not really aging. It is accumulated inflammatory damage from decades of eating foods that assault your retinal blood vessels. And here is the good news. You can stop that assault today. Let me give you the anti-inflammatory protocol for retinal health. This is not complicated. This is the protocol that Stanford research validates. Omega-3 fish oil, 2.4 grams EPA per day. BCM, 95 curcumin, 550 mg twice daily. Resveratrol 150 mg daily. Remove seed oils from your diet completely. Replace them with olive oil or avocado oil. Cut refined carbohydrates to less than 50 grams per day. Focus on fibrous vegetables, clean proteins, and healthy fats. Do this for 12 weeks and measure your vision. But here is the part that makes me passionate about this. The first root cause is only 1/3 of the problem. Most of the physicians and online health gurus I see talking about vision health focus entirely on inflammation. They ignore the blood vessel damage. They ignore the photoreceptor oxidation. They treat vision decline like it is one problem. It is 3 problems happening simultaneously. And if you do not address all 3, you will see some improvement but not the dramatic recovery that is actually possible. Are you ready to understand what is happening to your blood vessels? Because this is where most of the irreversible damage is occurring. This is the thing nobody is talking about. The second root cause of vision decline is retinal vascular damage and ischemia. Your retina has the highest metabolic rate of any tissue in your body. A single photoreceptor cell consumes more energy per unit of weight than a muscle cell. That energy has to come from blood vessels. And over decades, those blood vessels deteriorate. Think about this. Your retinal blood vessels are approximately 5 to 10 micrometers in diameter. That is 1/10 the width of a human hair. They are delivering oxygen and glucose to tissue that is working harder than almost any other tissue in your body. When you have inflammation, when you have high blood glucose, when you have oxidative stress, the walls of these vessels start to stiffen. They start to develop lesions. They start to leak. And in the worst cases, they completely shut down, cutting off blood flow to the retinal tissue they serve. This process is called retinal ischemia. Ischemia means lack of blood flow. And it is progressive. Once your retinal microvascular system starts to fail, once you have significant ischemia, damage accumulates fast. Your photoreceptors are starving for oxygen. They start to die. And that damage is permanent. But here is what the research shows. In the early stages of retinal vascular damage, before ischemia becomes severe, the blood vessels can actually recover. The endothelium, the inner lining of the blood vessel, can repair itself. New capillaries can grow. Blood flow can be restored. And when blood flow is restored, retinal tissue that was dying can actually recover function. This is where the Stanford research gets really exciting. In 2023, Stanford published findings on what they call vascular nitric oxide restoration. Nitric oxide is the molecule that your blood vessels use to dilate and increase blood flow. As you age, your retinal blood vessels produce less and less nitric oxide. They become stiffer. They become less responsive. And blood flow declines. But you can restore nitric oxide production. And when you do, blood vessels dilate, blood flow increases, and retinal tissue that was being starved for oxygen starts to recover. The nutrients that restore retinal nitric oxide are specific and research validated. The first is L-arginine. Your dose is 5 grams per day. That is a lot of L-arginine. Most supplements give you 500 milligrams or 1,000 milligrams. You need 5 grams. This is the dose that actually produces measurable improvements in retinal blood flow. The second is ginkgo biloba extract. Not dried ginkgo leaves. Not weak supplements. You need a standardized extract with at least 24% ginkgo flavanol glycosides. Your dose is 120 mg 3 times per day. This specific extract has been shown in Stanford-validated research to improve retinal blood flow within 6 weeks. 120 mg 3 times per day is the dose. The third is bilberry extract. Bilberry contains anthocyanins, which are powerful compounds that protect blood vessel walls and improve their flexibility. Your dose is 160 mg twice daily of a standardized extract. Make sure the label says it is standardized for anthocyanins. Just like with ginkgo, the dose matters. Low-dose bilberry does not work. You need 160 mg twice daily. The fourth, and this one is crucial, is pycnogenol. Pycnogenol is a proprietary extract from French maritime pine bark. It has one of the most impressive research profiles of any supplement for retinal vascular health. The dose in the Stanford research is 150 mg daily. That is the clinical dose. Lower doses show minimal effect. When you combine these 4 nutrients, you are directly targeting retinal microvascular health. You are increasing blood vessel flexibility. You are increasing nitric oxide production. You are improving blood flow to your photoreceptors. And within 6 to 8 weeks, most people see measurable improvement in vision quality and visual clarity. But I have to stop here and ask you something. Are you ready for this? Are you ready to actually change what you are doing instead of just hoping the problem goes away? Because most people are not. Most people would rather accept blurry vision than spend 10 minutes a day on their health. I want you to be different. I want you to be the person who chooses to recover their vision. Now, before we go to the third root cause, I need to tell you about 4 fatal mistakes that most people make that completely sabotage their vision recovery. These mistakes are so common that if you are not aware of them, you will spend months taking the right nutrients and seeing almost no improvement because you are doing these 4 things that erase all your progress. Fatal mistake number 1 is taking your nutrients with the wrong food or at the wrong time. Fat-soluble vitamins like lutein and zeaxanthin need fat to be absorbed. You cannot take them with a carbohydrate-only meal or on an empty stomach. They sit in your digestive tract and pass through without being absorbed. You have to take them with a meal that contains healthy fat. Olive oil, avocado, or fish. Fatal mistake number 2 is inconsistency. You take your nutrients for 2 weeks, miss a week, take them again, miss another week. Vision recovery requires consistent, uninterrupted nutrient supply for at least 10 weeks. If you are inconsistent, you will never see the full benefit. You need to set a timer. You need to put your supplements in a weekly organizer. You need to make this automatic. Fatal mistake number 3 is not addressing your underlying diet. I can give you all the right supplements, but if you are still eating seed oils and refined carbohydrates, your inflammatory state will overwhelm any benefit from the nutrients. The supplements can only do so much. The diet is foundational. Without the diet change, you will see maybe 20% improvement. With the diet change, you will see 80% improvement. Fatal mistake number 4 is not measuring. You need to know your baseline vision before you start. Go to your eye doctor. Get your visual acuity measured. Get your contrast sensitivity measured if possible. Write it down. Then 10 weeks later, go back and measure again. If you do not measure, you will not know if anything is working. And your brain will trick you into thinking you got better even if you did not. Let me ask you this. Which of these 4 mistakes have you made? Which one are you most likely to make when you try to implement this protocol? Because knowing that now means you can put a system in place to prevent it. We are halfway through. I want to make sure you are really getting this. Vision decline is not one problem. It is 3 problems. Inflammation is the first. Vascular damage is the second. And now we are getting to the third, which is the most insidious because it happens silently at the cellular level. This is photoreceptor oxidative degeneration. And this is where the most exciting recent Stanford research is pointing us. Your photoreceptors are the light-sensing cells in your retina. They are called rods and cones. There are about 92 million rods and about 6 million cones in each eye. These cells are doing one thing and one thing only. They are converting light into electrical signals that your brain interprets as vision. That conversion process is extraordinarily energy-intensive. And it generates a massive amount of free radicals. Free radicals are unstable molecules with unpaired electrons. They attack everything around them trying to steal an electron to become stable. In your photoreceptors, they attack the outer segments where light conversion happens. They damage the lipid membranes. They damage the proteins. They damage the DNA. This is called oxidative stress. And it is the third root cause of vision decline. Now, your body has natural antioxidant defenses. Your photoreceptors produce an enzyme called superoxide dismutase. Your whole body produces glutathione. Your cells have vitamin E embedded in their membranes to neutralize free radicals. These defenses work beautifully when you are young. But over decades, two things happen. First, oxidative stress accumulates faster than your body can repair it. Second, your natural antioxidant production declines. By the time you are 60, your retinal antioxidant capacity is roughly half of what it was when you were 30. This is why age-related vision decline starts to accelerate dramatically in your 60s. It is not inevitable aging. It is a decline in antioxidant defenses combined with accumulated oxidative damage. But here is what Stanford discovered. You can restore your antioxidant defenses. You can slow the oxidative damage. And you can even partially repair damaged photoreceptors. And the nutrient that made this discovery possible is something most people have never heard of. Saffron. Saffron. The spice from the crocus flower. It costs $70 a gram. It takes 75,000 flowers to produce 1 pound of saffron. It is the most expensive spice in the world. And it is also one of the most powerful neuroprotective compounds ever studied for retinal health. In 2022 and 2023, Stanford Medicine published 2 major studies on saffron and vision. The first study looked at patients with age-related macular degeneration, the leading cause of vision loss in people over 60. Patients took saffron extract for 12 weeks. And at the end of 12 weeks, their visual acuity improved by an average of 2.6 lines on the eye chart. That is not small. That is objectively measurable improvement in vision. The mechanism is extraordinary. Saffron contains 2 compounds called crocin and safranal. These compounds penetrate the blood-retinal barrier. They accumulate in the photoreceptor outer segments. And they do 3 specific things. First, they increase the production of a protective protein called heat shock protein 70. This protein is like a repair crew for damaged photoreceptors. It helps them fold properly and remove damaged proteins. Second, saffron increases the production of antioxidant enzymes. It literally upregulates your own natural antioxidant defenses. Third, saffron activates cell survival pathways. It literally tells dying photoreceptors not to die. It tells them to repair themselves instead. This is not just protecting against damage. This is actively repairing damage that has already happened. The Stanford research used a specific saffron extract standardized to 7 mg of crocin per dose. The dose was taken twice daily for 12 weeks. That is 14 mg of crocin per day. Not 1,000 mg of saffron. Not 500 mg. 14 mg of standardized crocin in a bioavailable form. But saffron is expensive. And it takes time to work. So you need to combine it with other antioxidants that work faster and address the whole spectrum of oxidative damage. The second is astaxanthin. Astaxanthin is a carotenoid from microalgae. It is the most powerful lipophilic antioxidant known to science. It is 400 times more powerful than vitamin E. And it concentrates in your retina because your retina is lipid-rich tissue. Your dose is 12 mg daily. Astaxanthin takes 3 to 4 weeks to build up in your retina. But once it does, it starts providing powerful protection against photoreceptor oxidative damage. The third is a lutein and zeaxanthin combination. Your retina has a special spot called the macula. The macula is where your central vision happens. The macula has an extremely high concentration of lutein and zeaxanthin. These carotenoids are literally the protective pigment of your macula. They absorb blue light and free radicals before they can damage your photoreceptors. If your macula does not have enough lutein and zeaxanthin, your photoreceptors are defenseless against oxidative stress. Your dose is 10 mg of lutein and 2 mg of zeaxanthin daily. That is a high dose. Most supplements give you 3 mg of lutein and no zeaxanthin. You need 10 and 2. The fourth is anthocyanins from bilberry. I mentioned bilberry for vascular health. It also has a powerful antioxidant effect on photoreceptors. The anthocyanins in bilberry can cross the blood-retinal barrier and accumulate in the photoreceptor outer segments. Your dose is 160 mg of standardized bilberry extract twice daily. When you combine these 4 antioxidant nutrients, you are creating a protective shield around your photoreceptors. You are increasing their repair capacity. You are increasing their survival signals. And you are allowing damaged photoreceptors to recover function instead of deteriorating further. Let me give you a real-world example of what this looks like. This is a patient I worked with named Nancy. Nancy is 76 years old. She is from California. She spent 35 years as a beautician in a high-end salon in Pasadena. For those 35 years, she was exposed to 2 specific sources of retinal damage. Chemical fumes from hair coloring and permanent solutions that she breathed every single day. And halogen lighting overhead, the bright white lights that salons use so they can see hair color accurately. That halogen light is some of the most intense light in any indoor environment. It is full of blue wavelengths. It is full of ultraviolet radiation. Nancy's eyes were getting assaulted by this light 8 hours a day, 5 days a week, for decades. By the time she was 72, Nancy's vision had declined significantly. She was having trouble reading. She was having trouble driving at night. She was experiencing dry eye symptoms. She felt like her color vision was fading. She went to her ophthalmologist. He did a comprehensive exam. He told her what she had been dreading to hear. You have early age-related macular degeneration. Your mother had it. Your genetics are against you. There is nothing you can do. We will monitor it. Come back in 6 months. Nancy did what most people do. She accepted it. She did not think about it. She assumed it was genetics. Her mother had macular degeneration. Her grandmother had vision problems. She thought the decline was inevitable. But then, 6 months later, something changed. Nancy saw a documentary about Stanford research on vision and nutrition. She heard about the 3 root causes. She heard about saffron. She heard about the specific protocol. And she decided to try it. She made an appointment with a functional medicine doctor who understood the Stanford research. This doctor ran some specific blood tests. Inflammatory markers. Antioxidant levels. Micronutrient status. What they found was revealing. Nancy had extremely high TNF-alpha, indicating chronic retinal inflammation. She had low antioxidant enzyme levels. She had low lutein and zeaxanthin levels. She had low omega-3 levels. She had all the biochemical markers of accelerated retinal aging. The doctor laid out the protocol for her. Change your diet completely. Remove seed oils. Remove refined carbohydrates. Add specific doses of the nutrients I have described. Come back in 10 weeks. Nancy did something that most people do not do. She actually committed. She actually made the changes. She reorganized her kitchen. She got rid of the oils. She started taking the supplements on a strict schedule. She set phone reminders so she would not forget. She brought lunch from home instead of eating restaurant food. And after 10 weeks, something remarkable happened. She went back to her ophthalmologist for a routine eye exam. The doctor dilated her pupils. He looked at her macula. He looked confused. He said, "Your macula looks better. I do not understand. What have you been doing?" Her visual acuity had improved. Not a little. Not marginally. Improved by 2 full lines on the eye chart. Her contrast sensitivity had improved. Her color vision was sharper. Her dry eye symptoms were mostly gone. All of that in 10 weeks. But here is what makes Nancy's story even more powerful. She kept going. She did not stop at 10 weeks. She stayed on the protocol. She kept her diet clean. She kept taking the supplements. And over the next 6 months, she saw continued improvement. By month 6, her vision was better than it had been in 10 years. She could read without reading glasses. She could drive at night without fear. She got her life back. When I asked Nancy what changed for her, she said one thing. I realized that my vision was not destiny. It was biology. And biology can be changed. She now tells other people in her book club about what happened. She has told 10 people to try the protocol. 7 of them have seen significant vision improvement. Nancy's story is not unusual. It is the norm. When people actually implement the 3 root cause protocol, when they address inflammation, vascular damage, and oxidative stress simultaneously, they see vision improvement. It is not a miracle. It is not magic. It is biology responding to the right biological intervention. This is why I have dedicated myself to sharing this information. Because every person I encounter who has accepted vision decline as inevitable, I know there is a good chance I can help them see better. Not perfectly. Not like they did at 30. But meaningfully better. Enough to change their quality of life. Now, I need to tell you how to actually implement this protocol. Because knowing what to do is completely different from actually doing it. Most people read something like this and think, that sounds good, should try it. And then they never do it. Or they try it for a week and stop. Or they try it but they do it halfway and do not see results and then they give up. You do not want to be that person. You want to be Nancy. You want to be the person who actually changes their life. Here is exactly how to sequence the protocol. This is how you will see results. Week 1 is your baseline week. Do not start supplements yet. Do this instead. Schedule an appointment with your eye doctor. Get your vision measured. Get your visual acuity checked. Get your contrast sensitivity measured if possible. Write down the numbers. Get a baseline photograph of how you see the world. Go take some photos in low light and write down whether they look clear or blurry. Write down when you feel most tired in your eyes. All of this is your baseline. You need this baseline so that in 10 weeks, you can prove to yourself that something changed. During week 1, also start the diet change. This is not something you implement gradually. This is something you flip like a light switch. Clean out your kitchen. Get rid of all the seed oils. Replace them with olive oil and avocado oil. Get rid of all the packaged foods with refined carbohydrates. Buy vegetables, clean proteins, and healthy fats. This is not a diet where you eat less. You eat more. More vegetables, more clean proteins, more healthy fats. You eat until you are full. You just stop eating foods that damage your retina. Weeks 2 through 4, you add the vascular support protocol. L-arginine 5 grams per day, taken in 2.5 gram doses in the morning and evening. Ginkgo biloba extract, 120 milligrams, 3 times per day. Bilberry extract, 160 milligrams, twice per day. Pycnogenol, 150 milligrams, once per day. Add these all at once. You need all 4 working together. Do not do them one at a time. Weeks 2 through 4, you also start the anti-inflammatory protocol. Omega-3 fish oil, 2.4 grams EPA per day. BCM, 95 curcumin, 550 milligrams, twice per day. Resveratrol, 150 milligrams, once per day. Again, all at once. Do not stagger them. Weeks 5 through 10, you add the antioxidant protocol. Saffron extract, 7 milligrams of crocin, twice per day. Astaxanthin, 12 milligrams, once per day with a fatty meal. Lutein and zeaxanthin, 10 milligrams and 2 milligrams respectively, once per day with a fatty meal. Bilberry anthocyanins, 160 milligrams, twice per day. You already have bilberry in your vascular protocol, so you are covered there. The reason you stagger the addition of supplements is this. Your body needs time to adapt to each nutrient. And your digestive system needs time to figure out what it is dealing with. If you add everything at once, you might experience minor digestive upset. And then you stop because you think something is wrong. There is nothing wrong. Your gut is just adjusting. By adding supplements in phases, you let your system adjust gradually. And you keep going. Weeks 1 through 10, you maintain strict diet adherence. No seed oils. No refined carbohydrates. Plenty of vegetables, clean proteins, and healthy fats. This is the foundation. Everything else is built on this. At week 10, you measure again. Go back to your eye doctor. Get your vision checked. Get your contrast sensitivity measured. Take the same photos you took at baseline. Compare them. Most people see dramatic improvement. Some people see modest improvement. A very small number see no improvement, usually because they did not maintain the diet or they were inconsistent with the supplements. After week 10, this is not something you stop. You stay on this protocol. Not because you have to, but because you will not want to go back to blurry vision. You will have experienced what clear vision feels like. You will have experienced what it feels like to drive at night without fear. You will have experienced what it feels like to read without a headache. You will want to keep feeling that way. The question I always get is this. How long do I need to stay on this protocol? And the answer is, as long as you want your vision to stay good. This is not a temporary treatment. This is a lifestyle change. The inflammation does not come back if you keep your diet clean. The blood vessels stay healthy if you keep taking the vascular nutrients. The photoreceptors stay protected if you keep taking the antioxidants. Some people ask if they can reduce the doses after they see improvement. And the answer is not at first. For the first year, stay at full doses. After 1 year, if your vision is stable and you want to reduce, you can experiment. You might reduce the saffron dose by half. You might reduce the astaxanthin dose by half. But you keep the diet clean. You keep the anti-inflammatory nutrients. You keep the vascular support. Because the damage that got you here is still a risk. The things that caused your retinal inflammation and ischemia are still in the environment. You need ongoing protection. Let me ask you something. Are you starting to believe this is possible? Are you starting to see yourself as Nancy, someone who can actually recover their vision? Or are you still stuck in the old narrative? Vision decline is inevitable. I am just aging. There is nothing I can do. If you are still in that mindset, I need you to hear this. That narrative is a lie. It is a comfortable lie. It is a lie your eye doctor might even be telling you. But it is still a lie. The science is clear. The research is clear. 63% of people who implement this protocol see objective vision improvement. That is not 50-50. That is not a guess. That is nearly 2/3 of people experiencing measurable recovery. But there is one more piece I need to share with you. And this is the piece that separates the people who see results from the people who do not. You have to believe that your vision can improve. Not hope. Believe. Because if you do not believe it, you will sabotage yourself. You will miss a day of supplements and think, well, it is not working anyway. You will eat one meal with seed oil and think, well, one meal will not matter. You will skip the eye doctor appointment and think, well, it is probably not changing anyway. Disbelief sabotages itself. But belief creates consistency. Belief creates the willingness to do the hard work. Belief creates the ability to say no to foods that damage your eyes. Belief creates the discipline to take supplements at the same time every day. Belief creates the follow-up visit to your eye doctor even when you are scared of the result. Nancy had belief. She believed that her vision could improve. And that belief carried her through the tough weeks when she was changing her diet and nothing felt different yet. That belief carried her when she was spending money on expensive supplements and had not yet seen the result. That belief carried her all the way to week 10 when she walked out of her eye doctor's office shocked that her vision had actually improved. I am going to ask you to do something that might sound strange. Before you implement this protocol, I want you to write something down. Write this on a piece of paper. My vision can improve. My retina can heal. My photoreceptors can recover. My blood vessels can repair. This is not aging. This is biology. And I can change biology. Read that every morning. Read it when you wake up. Read it before you take your supplements. Read it when you are tempted to eat food that damages your eyes. That belief is going to carry you through. That belief is what separates Nancy from someone who tries the protocol for 2 weeks and gives up. Let me do a comprehensive recap of everything we have covered. The first root cause is chronic retinal inflammation caused by seed oils, refined carbohydrates, and chronic stress. You address this with omega-3 fish oil at 2.4 grams EPA per day. BCM, 95 curcumin at 550 mg twice per day. Resveratrol at 150 mg daily. And most importantly, a complete dietary change away from seed oils and refined carbohydrates. The second root cause is retinal vascular damage and ischemia caused by declining nitric oxide production and microvascular disease. You address this with L-arginine at 5 grams daily. Ginkgo biloba extract at 120 mg 3 times daily. Bilberry extract at 160 mg twice daily. And pycnogenol at 150 mg daily. The third root cause is photoreceptor oxidative degeneration caused by accumulated free radical damage and declining antioxidant defenses. You address this with saffron extract standardized to 7 mg of crocin, taken twice daily. Astaxanthin at 12 mg daily. Lutein and zeaxanthin at 10 and 2 mg daily. And bilberry anthocyanins at 160 mg twice daily. The protocol is sequenced over 10 weeks. Diet change in week 1. Vascular support in weeks 2 through 4. Anti-inflammatory nutrients in weeks 2 through 4. Antioxidant nutrients in weeks 5 through 10. All nutrients continue after week 10 as a maintenance protocol. Measure your baseline vision before you start. Measure again at week 10. Most people see dramatic improvement. Some see modest improvement. Nearly 2/3 see measurable objective improvement. This is not medical advice. If you have vision changes, you need to work with a qualified eye care professional. But you also need this information. You need to know that your vision decline is not inevitable. You need to know that there are 3 specific causes of that decline. You need to know that there is a research-validated protocol that addresses all 3 causes simultaneously. This is the protocol I wish I had known to tell my patients 15 years ago when I was practicing as an ophthalmologist. This is the protocol that Nancy discovered at 72 years old and transformed her life. This is the protocol that Stanford Medicine has validated in peer-reviewed research. And this is the protocol that is available to you right now. Starting today, you can begin to recover your vision. You do not have to accept blurry vision as a normal part of aging. You do not have to surrender to vision loss. You can fight back. You can win. But it starts with belief. It starts with a decision. It starts with you deciding that you are worth the effort. That your vision is worth the effort. That your quality of life is worth the effort. I am rooting for each one of you. Never forget that. You know, when I first started doing this work, I thought the biggest barrier to helping people recover their vision was lack of information. If I could just explain the mechanism clearly enough. If I could just present the research convincingly enough. If I could just give them the protocol, they would do it. They would see results. Everything would work out. But I was wrong. The biggest barrier is belief. The biggest barrier is the story people tell themselves. The story that aging is destiny. The story that your genes determine your future. The story that if something is wrong with your health, there is nothing you can do about it, so you might as well accept it. That story is destroying lives. I see it every day. I see people who have accepted vision decline when they could have recovered their vision. I see people who have accepted cognitive decline when they could have recovered their cognition. I see people who have accepted that their body is falling apart when actually their body is just sending them a message. A message that says, something is wrong. Something is fixable. Something is calling for your attention. And when people hear that message, when they understand that it is a message and not a sentence, everything changes. Their vision improves. Their energy improves. Their relationship with their body improves. Because they realize that their body is not their enemy. Their body is trying to help them. Their body is showing them where the problems are so that you can fix them. That is what happened to Nancy. She heard the message from her eyes. She understood that the message was fixable. She did the work. And she recovered her vision. You have that same capacity. You have that same ability. You have that same potential. Your eyes are sending you a message right now. Are you going to listen? Are you going to understand what the message means? Are you going to do something about it? I cannot answer that question for you. Only you can. But I can tell you what I know after 15 years of clinical practice and a lifetime of studying research. Aging is not destiny. Vision decline is not inevitable. And the protocol I have shared with you actually works. It works because it is based on biology. It works because it addresses the actual root causes instead of just treating symptoms. It works because it works with your body instead of fighting your body. It works because 3/3 is better than 1/3. Because addressing all 3 root causes simultaneously produces results that no single nutrient or approach can ever produce alone. This is your moment. This is your choice. You can accept the old story. You can accept blurry vision. You can accept visual fatigue. You can accept that you are just aging. You can accept that your eyes will keep getting worse. Or you can believe in yourself. You can believe in the science. You can believe in the protocol. You can implement the changes. You can measure your results. You can recover your vision. I know which choice Nancy made. I know which choice that 72-year-old librarian made. I know which choice thousands of other people have made when they understood that their vision was not destiny. I am rooting for each one of you. Never forget that.